Crystals out of place, most common cause of vertigo, dizziness are super common symptoms. Did you know that there are several causes of these symptoms? There are even several problems in the maze that cause vertigo. Do you want to know what the most common cause is? Have you ever heard of loose crystals in the maze? Do you want to know more about this, which is the main cause of the maze? Stay here with me, in Otorhinolab at home, and you will know. Hello guys, my name is Mariana. I am an Otorhinolaryngologist, and in today's video we are going to talk about the main problem of the maze that causes dizziness. Crystals out of place. The name of this disease is benign paroxysmal vertigo. A big name, right? It's the famous BPPV. But before we continue, before explaining about this disease, if you are not yet subscribed, subscribe here to the channel ENT at Home. You are seeing that there are several cool videos with a lot of good information, quality information, to help you better understand your problems. So, subscribe and help spread our channel. Let's go. Dizziness, as I said, are super common symptoms. Labyrinthitis, a lot of people, in fact, almost everyone, including doctors, talk about labyrinthitis. First of all, we are going to make a deal, we are not going to talk about labyrinthitis. Do you know why? Because it's not correct. And I'm going to repeat this in every video about dizziness. When we talk about labyrinthitis, it seems that the whole problem of the maze is one thing, which is far from being true. There are several labyrinth diseases that cause dizziness, and labyrinthitis is one of them. It is rare and can be serious. The most correct, if we suspect or want to talk about a labyrinth problem, is to talk about labyrinth disease, a technical term, labyrinthopathy, which can, as I said, be several. There are several problems. And what is the most common problem? It's this one, the out-of-place crystal, VPPV. A lot of people have heard of it, because it is quite common. It is responsible for about 70% of the labyrinth problems. I've had it. So it's not an exclusive disease for the elderly patient, as many people think. Let's start with the symptoms. What does the patient feel? The story is more or less like this. Doctor, I was fine. I went to sleep, nothing. When I woke up, I turned in bed, everything worked. Guys, the first time the patient has this, the experience itself is very scary. There are people who think it can be an AVC, and can come to accompany with nausea, discomfort, vomiting. As we guide the patient, asking questions in the consultation, the patient says he has dizziness when turning. So he has the feeling that the environment is moving, that even standing, he is moving in relation to the environment. And that this dizziness is triggered by movements. What are the main movements? Turn in bed to the side, when lying in bed, when getting out of bed, when looking up to a shelf, when leaning against a chair on the couch, when lowering to get something, when turning quickly from one side to the other. Dizziness in general, lasts a few seconds, up to about a minute. Sometimes the patient has the impression that it lasts longer, because he gets sick, nausea, a bad headache, and that can last longer. But running around is about seconds to a minute. With the head still, there is no symptom. That's why it's a positional dizziness. It depends on the change in the position of the head. And every time the patient makes this movement, which triggers dizziness, there will be symptoms. So it can happen several times a day. Most of the time, the patient will know how to tell you which side he turns, which is worse. He may not have realized it, but when you ask him, is there a side that you turn that is worse? If he hadn't noticed it yet, at that moment he thinks, every time I lie down to the right, for example, it spins. There are patients who get very scared and go to the emergency room. And sometimes there is no doctor, no emergency room specialist. Then he takes a drug in the vein, a Dramin, for example, diazepam, and is released. And you will see that this treatment with the drug does not help much. In fact, it does not help at all. It only reduces nausea, discomfort at the time. Other patients take a long time to seek treatment. And as they have already realized that dizziness depends on the movement of the head, what do? They don't move their heads. They are careful when it comes to lying down, getting up. They are actually like a robot. They may have a false feeling of improvement. Now, I will explain why the so-called loose crystals cause all these symptoms. Look here, I've already shown that here is the internal cochlea, responsible for hearing, and the labyrinth. As part of the labyrinth, we have the channels, which are three on each side, and this region here, which is called vestibule. Here we have a bone structure that houses another membrane structure inside. Another model showing this membrane structure. It is filled with a liquid, C. And in here are the cells and structures that make the labyrinth work. In this region here of the vestibule are the famous crystals. They are not precious, they are calcium crystals. And they have a difficult name, otoconia. They are part of the structure of the vestibule. They are immersed here in a gelatinous material, which when they move, they capture the sensation of movement, forward, backward, from one side to the other, up, down. Can you see here? They are represented by these blue balls here. Sometimes there was a close here in our model. But these crystals can loosen and stop in some of these channels here. Film here closely. They will swim here in some of these crystals. Most of the time, they come to the posterior channel. So, these crystals are in the wrong place. When we make certain movements, especially those I have already mentioned, this crystal that is in the wrong place moves. It is as if it alters the gravity of this liquid. And it is as if this change leads to an abnormal stimulus of these cells, of these channels. And this abnormal stimulus is what triggers the vertigo. And why do these crystals come out of place? Most of the time, more than half of patients do not have a triggering factor. The patient lies down well and wakes up in the morning or in the middle of the night with vertigo. Mine was like that, suddenly. The only different thing in my case was that I was pregnant. Well, when there is a causal factor, the most common is a cranial trauma. Sometimes a mild trauma, sometimes a more serious trauma, an accident. And there are some studies that relate to problems of chaos, but this role is not so well defined. AVPPB is also more common when a patient has another problem in the labyrinth. So, I'm going to talk about some of these diseases in other videos. The Moreira disease, the nephritis. It is more common for the patient to have these crystals loose when the labyrinth already has another problem. And how do we know that this is what the patient has? How do we do this diagnosis? We do some maneuvers and observe the patient's eyes. When the patient has this crystal loose, a movement of the eye called nystagmus will occur. The eye turns and the nystagmus of the patient, with VPPB, has specific characteristics that help me in the diagnosis. Look, I'm going to put a video here with the characteristic nystagmus of a patient with VPPB. By evaluating this nystagmus, we confirm the diagnosis, the side committed and the channel committed to direct the correct treatment. Yeah, and the treatment. Do you know what's most interesting about the treatment of this disease? You don't need medicine. Vertix, Dramin, Betestina, none of that helps. The treatment is with the hands. And it's not magic, it's a maneuver, a repositioning maneuver of these crystals that has a very high resolution index. In another video, I'll explain how these maneuvers are done, which sometimes even seem like a miracle. Many times the patient leaves the consultation cured. So, did you like this information? Who has had BPPV identified? Did you understand what happens in the labyrinth? Did you think this video was useful for you? If you know someone with a history of BPPV, write it in the comments. Suggestion of VPPB, loose crystal, direct this video, who knows it can help. And subscribe to the channel, write in the comments suggestions of themes for us to share with you. Share the videos that you think can help other people, and until the next video.